Hello everyone, my name is Zainab Al-Nakli. Today I will talk about the Artificial Pancreas Device System, which is a medical device for type 1 diabetes. So first, what is the pancreas? Pancreas is a big organ. It's about 98 grams. Also, it's an important gland in a human body. Pancreas has two main functions, endocrine and exocrine. Endocrine function is when the pancreas produces chemicals or hormone that regulates blood sugar, such as insulin and other. Exocrine function is when the pancreas produces enzymes that help digest our food. Pancreas produces the pill that helps to make lipids readier for digestion. The anatomy of pancreas. Pancreas located in the upper abdomen behind the stomach next to the small intestine. Healthy pancreas mean a healthy digestive system. Unhealthy pancreas mean trouble in digestion. When the carbohydrate is broken down into a glucose and passed into the bloodstream, insulin will be released from beta cell in the pancreas to help the glucose to enter to the cell. This table shows the range of the glucose in the blood. It is about 3 types of testing, one random, 2 fasting, and then the after 2 hour eating. So when the person is fasting, the normal level of glucose should be below 5.5 millimolar per liter. If it's 5.5 to 6.9, this person has pre-diabetes. If it's 7, so this person has diabetes. So now I will tell you how the insulin help the glucose to enter the cell. Insulin will bind to the alpha receptor, and then the alpha receptor leads to phosphorylate beta receptor, which stimulate the GLUT4 to attach to the cell membrane. Now the glucose can enter to the cell membrane. However, in type 1 diabetes, insulin will be not released from the pancreas, so the glucose level will be higher outside the cell membrane, as can be seen in this graph. Last but not least, the scientific invented a medical device that release insulin for the cell instead of the pancreas. This device called the Artificial Pancreas Device System. FDA approved the use of this device in 2016. This device, also called closed-loop insulin delivery. It is a wire under the skin of the abdomen that pump insulin to the body by sending a signal of the glucose level to the insulin pump from another wireless base. And then the result of the glucose level will show in the pump screen, which is this one. Insulin pump release insulin by using a mathematical equation. This device makes enough insulin for the person with type 1 diabetes by monitoring the glucose level every 5 minutes by using information from the CGM. So if the glucose level low, this device will decrease or stop the insulin pumping. If it's high, this device will release more insulin to the body. This device requires a minimum of 8 units per day to operate safely. So the patient require less than 8 units per day should not use it. And also, children under 7 years old should not use it. Finally, the advantage and disadvantages of this device. The advantages include increased flexible in lifestyle, predictable insulin delivery, prices insulin delivery. However, the disadvantages of this device: risk of the skin infection at the catheter site, and letting others know that you have type 1 diabetes or diabetes. Thank you for listening, and this is my reference list if you want more information. Thank you.